Hello, I am Alexey Kalmykov, medical doctor, scientist, teacher and entrepreneur. Today is the 29th of June 2022. I'd like to represent some clinical cases regarding which people has admitted to our United Medical Volunteer Center of the Association of Humanitarian Centers. Okay, early at the, not even morning but night, it's just 5 minutes past midnight, a 27 years old female has admitted with the complaints on some pains at one point in the lower part of the leg, chin probably, behind where the soft part is. It's literally what she said, and she has this sharp shooting pain that it is intermittent. It doesn't hurt when pressed. On this side the veins are slightly visible. Perhaps she thought that there was a problem in them, and while there were no such problems before. In the morning she wrapped her leg with a damp towel and it began to shoot even harder. She doesn't know the reason, and she supposed that it is somehow connected with her smoking. We perform this distant diagnosis as much as we can. We asked this girl, this young woman, to turn on her camera, her back camera on the phone, and to perform some palpation and so on. So we made some instructions remotely, and based on this we supposed that there is some trauma she didn't realize, and suggested appropriate basic treatment. Today we'll know what is the actual situation with this woman. The next admission was about baby, 3 years old. Her mother complains on the warts on the skin of the child, and she also emphasized that similar warts she found her skin during the pregnancy period. Again, it was impossible to remotely, clearly perform the diagnosis and differential diagnosis of these formations, while we at least ask the woman also to direct her camera on these formations on the skin. Finally, we have suggested the local dermatologist, and we'll follow up this case, this woman, to know what's finally there is a problem and how we can continue help. Other admission was from 36-year-old woman who has experienced severe swelling of her fingers, especially in the morning and night. Without any rise of body temperature, and her feelings were like the whole body is burning, and the arms and legs as well. In this relation, she has been with her child in the village, and there is no medical doctor around, so we started our remote diagnosis and follow-up instantly, and we realized that she had such a reaction on some types of food. I don't remember exactly, because other doctor has examined her and performed this conversation, and finally we agreed about changing the diet and monitoring the condition, and used desensibilization therapy as well, and follow up her remotely as soon as anyway she doesn't have any other chance to get supplied or supported. So that's all for this case. The next admission was from 22 years old man. She has formulated his request as generalized anxiety disorder with a depressive component, and he has requested help. We redirected this inquiry to the clinical psychologist, and he will continue to follow up this person until the success. Okay, the next inquiry was about the child, 1 year old, and his mother has complained on the high temperature, 38.5 degrees by Celsius, the second day. No other symptoms. She gave Nurofen, it's ibuprofen, and with good result which keeps for 6 to 7 hours, and she requests what to do. By remote discussion in video format, we realized that she had previously infection. One of possible variant, it might be some influenza or something like that, and we suppose that this might be a viral infection in her child. We realized that she didn't give enough fluid, enough water to her child, and we increased and administered proper watering, proper water supply, and we'll continue to follow up this child. While I definitely know that at the end of the yesterday he already has improvement, and probably there was such a temperature reaction on infection, and it might be even enough to give him enough water to drink, and that's all. But anyway, we will follow up. So these are not all of our cases. As far as I remember, yesterday we had 42 inquiries from people, and we assessed our medical help free of charge as an initiative of our United Medical Volunteer Center. If you want to support our initiative by anyhow, maybe by joining our team, if you're a medical doctor, or you want to support by money to pay our doctors for this support, for administration costs and so on, or you have some ideas about supplying anything medical like pharmaceutical preparations or so, you are kindly welcome. See you, keep healthy.